2 months after England released an expert report discouraging medical interventions for transgender youth, most Canadian provinces have signaled that they do not plan to change the current gender-affirming care treatment model. And yet, some experts say there is inadequate research on this treatment model, which supports medical interventions that affirm a person's gender identity where it does not match a person's sex. Alberta pediatrician Dr. Sam Wong disagrees with one review of the UK's Youth Gender Identity Services, specifically how it concludes that medical intervention for transgender care is not based on medical evidence. Joining us today to discuss Canada's gender-affirming care model and how it could be improved is Hadassah Alencar, journalist at Canadian Affairs. Hadassah, welcome back to Forum Daily.
Great to be here.
Now, before we dive in, can you tell us a bit about what gender dysphoria is and how healthcare professionals might address this in patients starting from early ages before the child reaches puberty?
So, gender dysphoria is the mental health condition where the child or as anyone can experience psychological distress when their biological sex doesn't match the gender they identified with. So in these early stages before puberty, there is no medical intervention, meaning the child is not put on puberty blockers. They don't undergo any surgeries to look like their identified gender during this time. But what all medical professionals can do is assess the child if they have gender dysphoria, meaning that they ask questions about their history and their mental distress. Questions like, how long have you felt this way? How does the mental distress affect your life and how you're able to do things and how you feel about yourself? And that medical professional can then refer the patient to a mental health services of some sort to help improve their anxiety and stress. Or if they are a psychologist themselves, they can give those services to the child.
Canada's primary treatment model for transgender youth is the gender-affirming care model, which consists of several steps. Could you summarize our current treatment model and how it works?
Yes, so the gender-affirming model is really summed up nicely in its name. It's that all the care given within this model seeks to affirm the child's chosen gender. So for many transgender kids, the first step is social transitioning. This means they adopt a new name, new pronouns, they start wearing new clothes, act like the gender they want to be. And a medical professional working under this model will support the child's chosen gender by calling them their name and their new pronouns. And according to different health professionals that I spoke to and the institutions that I spoke to, this social transitioning can happen at any age. Then if the child is diagnosed with the...
Sorry, carry on, sorry.
Yeah, then if it's a long process, so I understand. Then if the child is diagnosed with the gender dysphoria, they can be referred to a transgender clinic to undergo the medical intervention.
And approximately how many children that are diagnosed with gender dysphoria continue to have this condition when they grow up, and how many no longer experience gender dysphoria by the time they become adults?
This is an area really lacking in studies. We don't know the process and how many children are going to continue on with gender dysphoria, how many have. What we do know is that in previous models, there were less children that continued with gender dysphoria into adulthood. Under the gender-affirming care model, more children seem to continue with gender dysphoria into adulthood or to transition as an adult.
Some healthcare professions still adopt Canada's previous treatment model of biopsychosocial development. How effective was this model?
So this used to be the primary model used in Canada and other countries. And one of the biggest differences is that the goal was to try to make the child more comfortable with their birth sex, under the grounds that if a child was comfortable with their birth sex, they would avoid the difficult biomedical interventions and treatments needed to transition later on. And I spoke to Dr. Kenneth Zucker, which was the clinical psychologist, is a clinical psychologist, and was one of the lead medical professionals who helped develop this model and continues to employ it at his private practice. And he suggests that social transitioning is something that can influence a child's gender identity into the future.
Hadassah, thank you so much.
Thank you.